My name's Libby Hoy. I'm here from Long Beach, California. I'm the founder and CEO of Patient and Family Centered Care Partners, and I am a patient family advisor. As a caregiver for 3 boys living with mitochondrial disease, I learned early on the value of partnering with our healthcare teams to really create care plans that were workable in our family life and really worked with them to develop our priorities as kids and also as a family to inform sort of the care plan that we would create with our team. And having been in many, many hospitals, many, many days and nights, I realize that we see the organization from a different vantage point, and that as we identify workarounds in the environment or as we move through processes, we're able to kind of highlight the reality of the situation that's going on. And so I joined the Parent Advisory Board at Miller Children's Hospital, which was the hospital my kids received most of their care at. And very quickly saw the value of integrating the patient-family perspective into quality improvement. I think the key is to act on the respect that patients and families have been calling for a long time, and really creating avenues for patients and families, again, to inform the process. Not necessarily at the back end to kind of give feedback. That's been the mode kind of up until this time, but we're really finding that if we can bring in patients not just at the end to give us their feedback, but at the upstream, if you will, to really help design solutions, then those solutions are often more impactful and translate into practice more easily. One example that jumps to mind is an opportunity I had to participate in a lean quality improvement event at our local hospital, looking at a clinic wait times in a clinic that my kids were served in. And as the discussion went on, the physician mentioned that he felt the families didn't really care about their kids because they weren't calling back. And I sort of took offense at that, obviously, and said, well, that's interesting, because I feel like physicians don't always call us back when we're looking for results or what have you. And as the conversation continued, we identified the fact that within the phone tree, there were voicemail boxes that were no longer being checked because those staff had moved on. And here we were making these negative assumptions about each other's motivations, and yet it was a technology failure of a phone system. If we both weren't in that same room, we probably wouldn't have identified that, and how much longer would those assumptions have gone on. So I think that's one concrete example. I think clinicians really need to get comfortable with inviting the patient and the family into the clinical relationship. It's not a natural for either one of us, really, as patients and family members. It takes a while to understand sort of what your place in the healthcare environment is. And I think clinicians as well are not necessarily comfortable establishing those partnerships. But I think that's what they can do, is sort of open that door. I think it's really important to look at patients and families, really engage patients and families, move to a place where they're calm, they're confident, and they're comfortable in the healthcare environment, as opposed to the happy patient. We really want to engage people in a meaningful way, and I think as healthcare providers can establish that environment, they'll get back such better information to make decisions on, and all the benefits of partnership in the clinical relationship.